Start tonight with our top story this evening. The Chancellor George Osborne has signed a health devolution deal for London. The agreement, which was signed today at Great Ormond Street Hospital, will see the launch of 5 pilot schemes designed to transfer power over NHS services from Whitehall to local groups.
So the pilots that are being announced today, I hope, are just the start. And I hope we can come back in a year's time and we can really take a major act of devolution here in our capital city, and not only therefore improve the healthcare of this city, which people are working so hard to do anyway, but also to improve the sense that people are in control of their own lives here in this capital. So it's potentially a very big moment and the start of a very important journey.
Now, for the first time, the Mayor and boroughs will join health professionals to make decisions on the delivery of the capital's £15 billion health budget and social care services. The Mayor of London, Boris Johnson, said the system will help from the bottom up.
The whole exercise is going to be overseen from City Hall, in the sense that I chair the London Health Board with London councils, and we'll have general oversight of what's going on. But this is very much not a top-down thing from City Hall. This is going to be run from the bottom up by healthcare professionals in the neighbourhoods, by social services, so that, typically there will be quite a limited number of vulnerable people who need particular care, whose interests can be anticipated. And the idea is to focus on them and to help them.
Now, the borough of Barking and Dagenham is one of the London boroughs to launch a pilot scheme on this, and they'll try to integrate primary and secondary care more closely, focusing on intervening early and managing the chronically ill. At least that's the plan. The leader of the council says this is the next step in integrated care services.
Devolution is the only way to go. We need local services for local people, and in Barking and Dagenham we've led the way with our neighbours in Redbridge and in Havering in doing integrated care services for a little while now. This is just taking it to the next step, where we can bring our defined management that we've done as local government authorities, bringing that in to help our partners in the NHS. So in Barking and Dagenham we talk about personal place. Now we want to make sure that we have holistic services. It doesn't matter who delivers them, whether it's us as a local authority, whether it be the NHS, or whether it be private or voluntary sector partners. What we want to make sure is that the resident is in the centre of all those services. So if you've got somebody who's elderly or someone who's disabled or someone who just needs medical assistance, we need them to get the best possible care at the right locations, no matter what borough they live in. In 10 years, from 2010 to 2020, we're asking to lose 70% of what is our running costs. Well, we're achieving that. I'd like to see the private sector do that. We are achieving it in local government. So I think it's just national government recognising that local government is probably the best bit of government to achieve this, and work with our partners, whether it be the NHS, whether it be the police, in doing what we need to do for the wider community. Because at the end of the day, the councils, every council has more interactions with residents than any other part of government.
Now, with me now to discuss this is Dr. Tonyosullivan, who is a consultant paediatrician and the co-chair of Keep Our NHS Public. Dr. O'Sullivan, I should say, this sounds, on the face of it, a sort of positive thing. If you listen to the government, we're going to devolve, we're going to have a London-specific health service. What's your reading of it?
Well, starting with that, it sounds so good, and it's not. It sounds democratic, but it's far from democratic. There hasn't been consultation about it, and I know in Lewisham, where I work, some senior councillors don't even know about this until today. They found out when I found out by us telling them. The consequences are quite worrying, and the context is very dangerous. The context is that by 2019-20, there is predicted £30 billion shortfall in NHS funding. The government say they're going to give some of that, but 22 billion is still a shortfall. We're expected to save from cost savings in the health service, and local authorities are being seriously hit. In Lewisham, 31% of social care budget has already been reduced, and in George Osborne's comprehensive spending review, there were plans laid out that over the next 3 years, Lewisham's funding will be cut by £200 million a year. So in that context, the consequences are very likely that local authorities around London and up and down the country will be looking desperately for savings. They may transfer some health care, such as care for elderly with dementia, into social care, which is means tested and charged, and they will be able to do that for legislative reasons that have paved the way. The Health and Social Care Act ended the Secretary of State's direct responsibility for providing a universal health service, and clinical commissioning groups no longer have a duty to provide universal healthcare. That might sound surprising to you, but it could be that either local authorities start charging for services that they've taken from health into social care, or clinical commissioning groups stop providing certain services.
So just to make this clear, because it's quite a complex issue, local authorities will themselves be in charge of the budget, but if it's being cut along with their other budgets, they're going to have to find savings, in even more places. Is that what you're saying?
Yes, the pressure to save money is intense. There's no fat to be cut off. I mean, I've been working in the health service for over 23 years in Lewisham, and we've been saving 3% every year. Then it went up to 5%, 6%. There's no spare money left. So we're at the point now where services in some parts of the country are being charged, or the public are being debarred from them. You can't have this. For example, there are people who have cataracts, and this again is very often old and vulnerable people. You can have one cataract operation but not the other. You can have one hearing aid and not the other. There's some very serious consequences already in the system. So, I mean, I've spent my life working with families, disabled children and their families, and my whole ethos is to provide at the child's at the level of care that he needs, integration between social care professionals, health professionals, mental health professionals, and indeed education as well. But integration of budgets, financially driven at these times, is a very, very worrying development.
Dr. Tony O'Sullivan, thank you so much for coming and talking about that. He's, of course, the co-chair of Keep Our NHS Public, and we will, of course, be following that story closely here on London Live. Now,